when it comes to doctors, there is a relationship. It's a relationship between the doctor and the patient. And so what we have is, we have a relationship, we have a transaction. Within that transaction, you give the doctor money, they give you treatment in return. So in order for any relationship, any transaction to be effective, there needs to be trust. There must be trust between the doctor and the patient. Anybody out there who says that they don't trust their doctor, well, why are you going to that individual? Go to somebody else. So in essence, people go to the doctor because they trust them. They go to them because they need help and they believe the doctor can give it to them. So what makes this relationship necessary, this transaction? It all comes down to what's called asymmetric information. With asymmetric information, you have one party who knows more than the other. Right? They have different levels of information. The common example of this is the example of the used car. So when you buy a used car from somebody, the seller of that car knows more about the quality of it than the buyer does. There's a differing level of information about it. In medicine, that's why this relationship exists. Because what we have is we have the doctor who knows more about how to get the patient better than the patient does. And so this asymmetric information is what makes it necessary. Now, you can argue sometimes that, sure, I can go out and figure out what's wrong with me. I can do research, get some medical books, and so forth. But it might take you weeks or years to figure it out, whereas a doctor can figure it out right away. And so that different level of information and knowledge is what makes this and pretty much any other relationship possible. Now, with that, we have an agency. So if you recall back to any of your other classes, agency is when one party makes decisions on behalf of another. And an example of this is when you have the CEO of a company making decisions on behalf of the shareholders, people who own the company. So with physicians, or the patient-doctor relationship, you have that same idea. So you have doctors making decisions on behalf of the patients. The doctors tell you what you need to do. They're telling you what to get done. So because patients don't know what they need to get better, they go to the doctor and allow them to make the decisions for them. Now, they are free to disagree with it or ignore it, but for the most part, that's what we have. Okay. Now, within medicine, there's also a lot of uncertainty. No one knows for sure what treatments will work, what ones won't, and so forth. But again, this comes back to the idea of doctors. Right? And so if we look here, in medicine, we have our uncertainty. So in the medical field, there's uncertainty either in incidence of getting sick or injured and in the outcome or quality. So with the incident, where you don't know if you're going to get sick or not or when, that's why we have insurance. But on the other side of that, there's uncertainty in the treatment outcome or the quality of it. That is where agency comes in. Because nobody knows for sure how effective a drug is going to be or what will work and what won't. But doctors can make much better decisions about what type of medicine you need, how much, dosage, usage, and all that. Whereas the patient really doesn't know. It's really a guessing game. And so they go to the doctor in order to get that information. Now, the one question that I asked was, do you trust your doctor? And most people are going to say, yes. Well, why? How do you know your doctor's good? Maybe you heard some things, but for the most part, people don't have an accurate gauge of how good or bad a doctor is. Right? So how do you know? The way you know is that you call your doctor, doctor. That your doctor is either a medical doctor or a doctor of osteopathic medicine. And that individual got that distinction, got that certification. What that comes down to is you trust the title. You trust that if your doctor has a medical license, that person must be qualified. So what happens is through licensure, one medical body is making decisions on behalf of all consumers. So the American Medical Association, the one that issues the medical license, they are making decisions on behalf of all of you. They are setting the requirements about what doctors need to do in order to get their license and keep it. Because they know that if they keep the standards high, doctors will be better, and so in the end, you will be better off. Now, that's the positive side. What's the negative side? Well, the negative side has to do with the fact that because you have a license, the supply is fixed. So because the American Medical Association says to become a doctor, you must do X, Y, and Z, not everyone becomes a doctor. And so what happens here, if we look here, we have so we have supply with licensure, and it's fixed. Because no matter how much wages go up, salary goes up, profits, however you want to look at it, because that licensure is in place, because nobody else can just become a doctor, the supply is going to be fixed. On the other hand, if supply is open, as the pay in that field goes up, more people are going to enter that field, so the quantity supply is going to be higher. So what happens then is, if we had no licensing in the medical field or any field, you're going to have an equilibrium here, where the supply equals the demand. That's where you would have P open and Q open. But in reality, because of licensure, our supply and demand are going to intersect up here. So you have a price and a quantity. So because of licensing in the medical field, there is less units and you pay a higher price for it. So doctors make more money because of that. And also what's going to happen is when there is demand, it's going to react differently depending on license versus non-license. So in the case here, without license on the right-hand side, as demand goes up, because supply is open, the equilibrium is going to adjust. Price is going to go to P1 to P2. But because it's not fixed, the supply, quantity is going to go up as well. However, with licensure and with physicians, as demand goes up, those returns are going to be received entirely by the existing physicians. Because the supply, again, is fixed, quantity is going to stay the same, and so the price, wages, salary, whatever way you want to look at it, is going to go up. And if we go back here, this explains why, in recent years especially, the pay of physicians has gone up exponentially fast, because demand for healthcare went up, because of the Affordable Care Act, more people having insurance, whereas supply of physicians stayed relatively constant. Now, the other thing is that licensure improves quality. Because of licensure, now we talked about how the pay is higher. Now because of that, the medical field is able to attract higher quality individuals because it's able to offer them that pay. And so because of that, it brings in people who are higher quality, and so the outcome is better for the patients. And on top of that, by different regulations that have been placed in order for a physician to keep their license, they have to do ongoing studying and with all that, again, the quality is going to be higher. Now, when it comes to licensing in general, there's strong and weak licensing. The requirements are different by specialty. And those factors are going to depend on a few things. So the first one is information asymmetry, where the doctor knows more than the patient. In some cases, the doctor knows a lot more than the patient about what to do to get him better. In other cases, the doctor might only know a little bit more. Now, when the information asymmetry is higher, there's going to be a need for stronger licensing, because if there's not a difference in asymmetry, if the doctor's doing something wrong, the patient will know. Where if it's high, they won't. Now, what goes along with that is who can choose. So with only the trained professionals being able to choose appropriately, you need strong, because again, you're putting, there's not much of a checks and balance in there. But if it's consumers can choose, you don't need to be as strong. And the risk also plays in. Higher risk, stronger licensing. So some examples within the medical field: neurosurgery, organ transplants are going to have strong licensing, whereas podiatry and eyeglasses are going to have weaker. Because, for example, with eyeglasses, you know if you need eyeglasses for the most part. Whereas an organ transplant, chances are you don't know unless the doctor tells you. So anyway, this just looks at the licensing of physicians, strong versus weak, and the effects of it.